Welcome to Module 3 of the REACH Parent webinar series. As a caregiver, you have given up personal time to take care of your injured adult child. What is equally important is that you take care of yourself. This module focuses on your physical health, which is just as important as your adult child's. Incorporating healthy habits into your life not only helps you stay well, it also helps you manage your stress and emotions. As a caregiver, you may find you have much less time for yourself and that your stress levels are higher than they once were. To be a good caregiver, you must also take care of yourself. Taking care of yourself does take time, but it is time well spent. How well do you take care of your body? Do you keep your own doctor and dentist appointments? Make this a priority as you would helping your adult child keep his or her own appointments. Do you take prescribed medications as directed? How often do you make time to exercise? Exercise is one of the best things you can do for your health and your stress levels. Finding time to exercise can be tough, but choosing an exercise you enjoy makes it easier. The American Medical Association recommends that adults get about 150 minutes a week of moderate exercise. This is 2.5 hours. Take a 30-minute walk 5 days a week, and you've met the goal. Invite a friend or take the family dog, anything that makes it something you look forward to. Our bodies also need plenty of sleep. Our cells regenerate while we sleep. Our muscles rest, and our brains hit the reset button. Doctors recommend between 7 and 9 hours a night for adults. If you are having difficulty sleeping, let your doctor know. In addition to exercise and sleep, the best thing you can do for yourself is eat well. The body needs nutrients to heal and perform its best. The brain needs nutrients to function as well. Good nutrition will increase energy levels, boost the immune system, help strengthen muscle and bone, and help you sleep better. In addition to eating nutritious foods, there are foods to avoid or eat only in moderation. Avoid saturated fats that you find in butter and meat. Avoid salt and sugar. Try to choose healthier options instead. One of the major goals of a healthy diet is to maintain a healthy body weight. Excess body weight is known to contribute to multiple diseases and puts extra stress on our bones, joints, lungs, and heart. The American Heart Association and the American Diabetes Association both have excellent dietary guidelines available on their respective websites. The ADA website explains the Create a Plate diet. These guidelines are quick and easy to follow, so let's review them. Create a Plate is based on portions and choices. One half of your plate should be home to non-starchy fruits and vegetables. Consider salad, green beans, carrots, broccoli, tomatoes, and so on. 1/4 of the plate is home to grains and more starchy foods like corn, peas, pasta, bread, rice, potatoes, or tortillas. The last 1/4 of the plate is protein. Protein is vital in building and maintaining muscle mass and in helping your body function and heal. Healthy proteins include lean meat, eggs, dairy products like milk and cheese. Vegetarian choices include tofu, lentils, and beans. In addition to eating the correct foods in the correct portions, we can boost nutritional value by choosing carefully. Colorful fruits and vegetables tend to be packed with more nutrients. Fresh is always best when it comes to produce. Frozen should be your second choice, with canned goods being last. If you frequently utilize canned vegetables, rinsing them first will remove some of the excess salt. Reading labels on packaging can also help us make educated choices. Avoid foods that have added salt, added sugar and fat. Choosing lean meat, chicken, and fish is an easy way to reduce calories and fat intake. Limit caffeine intake and seek energy from food sources. Avoid processed foods like hot dogs and bacon, or at least eat them sparingly. Use heart-healthy fats to cook with, like olive oil, canola oil, and sunflower oil. Cooking sprays are great too, and cut down on the amount of fat used. Choose healthy methods to prepare your family meals. Broil, bake, roast, steam, and grill instead of frying or sautéing. Help your loved ones make good nutritional choices to aid in healing and recovery and to create healthy habits as well. Staying hydrated is very important for good health, and water is nature's best fluid. Juice should be consumed sparingly as it is high in calories, as are most sodas. Encourage your loved one to drink whenever thirsty. Keep a water bottle nearby to facilitate this. Dehydration can have serious effects, so watch for signs in yourself and others. Dark urine, difficulty urinating, fatigue, headache, and difficulty breathing can be signs of dehydration. More serious symptoms include vomiting, muscle spasms, cognitive confusion, and constipation. The more exercise a person participates in, the more water they need to drink. Soup, popsicles, and smoothies are also a good source of fluid. Alcohol, although a beverage, increases your urination and can lead to dehydration. Contact a doctor if you or your adult child have signs of severe dehydration. As mentioned, alcohol can dehydrate a person, and it has no nutritional value. It can irritate the bladder and cause depression. Alcohol, as well as other substances that impact the brain, can have long-term negative impacts on health. Misuse of alcohol or drugs is also potentially life-threatening. Smoking also has long-term health risks, including death. Over 1,000 people die each day because of smoking-related illness, including permanent lung damage, heart disease, stroke, and cancer. In addition, smoking impairs your immune system, causes yellowing of the teeth, and premature aging, known as lots of wrinkles and rough skin. Smoking and tobacco cessation programs are available through the VA or your primary care physician. Secondhand smoke is also unhealthy and causes lung disease. Smoking marijuana or other substances is equally as harmful. Misusing and abusing prescription medication, particularly painkillers and sleeping pills, can cause death due to accidental overdose or interaction with another medication or alcohol. Being a primary caregiver is a very tiring and stressful job. Turning to alcohol or other substances for temporary stress relief can be dangerous. If you feel you are doing this, let a doctor know. He or she can find someone to get you help. Another factor that affects your physical health is stress. Many people encounter stress when they are dealing with financial issues or legal issues. Being a caregiver has probably given you more responsibilities than you were used to before your son or daughter was injured. Depending on the degree of your adult child's injury, you may need to consider getting some financial advice and legal advice if necessary. This is often available through the VA or your military base. You and perhaps a spouse are still managing bank accounts, paying bills, paying for housing through rent or mortgage. You may have other property or assets to watch over. Your ability to work may have been impacted by caregiving, and your adult child's employment and income may be an issue too. Knowing what financial and support benefits your adult child is entitled to is vital. The resources on this screen all focus on educating you and providing assistance to you in obtaining all the benefits due to your adult child. You can also talk to your loved one's social worker or call the Veterans Benefits Administration at 1-800-827-1000 or check out their website. These resources will also be listed on the final module of our webinar series. Depending on the extent or number of your loved one's injuries, you may be dealing with one or more systems of care within the VA network. Polytrauma addresses multiple injuries, and other specialty systems have been created to serve the most common post 9/11 combat injuries. Whether or not you are utilizing a VA hospital, your adult child may need to see more than one doctor, more than one therapist, and be on more than one medication. Keeping track of it all can be a challenge. Ask for the business card of any doctor or nurse you see. Keep a list of the phone numbers handy that you need for appointments or emergencies. Use a wall calendar and maybe the app on your phone with reminders to help you and your adult child stay on track with recovery treatment. Having a system in place will help decrease your stress levels. At times, getting questions answered and getting the help you need for your loved one can be daunting, frustrating, and tiring. Many phone numbers you need can be found on the internet. When calling people for assistance, practice the following strategies. Be patient and persistent. Long wait times for phone calls are not unusual in any medical facility. Have a pen or pencil and paper ready. First, write down the place you are calling and the number so it's easy to find it when you need it again. If you are transferred to someone who can help you more efficiently, ask the person if they have a direct line so that you can call them again. Write down questions in advance and record the answers on the paper. If you do not understand what someone tells you, ask them to clarify. If you need to call back, ask when you should call and who you should ask for. Keep your phone call notes as documents. You might need them to gently remind someone in the future of the conversation you had and what you were told. You and your loved one need to discuss your role in his or her care. If you are to be involved in decision making, your loved one will need to tell the healthcare team so that you can legally be included. If your loved one is not capable of making this decision because of cognitive impairment, you will need to talk to the healthcare team to understand your options. If you are not involved, you can still help prepare for doctor visits. Make a list of important questions to ask the doctor and be prepared to take notes at appointments so you can remember what was said. If you or your adult child need help or assistance, make sure you ask for it. Be prepared to describe symptoms thoroughly. Describe what is happening, how often it happens, and when it happens. Be aware of medications and doses, including any over-the-counter drugs. Report any health changes. Have there been medication changes? Have there been any problems associated with these changes? Are there new physical symptoms such as an increase in pain? Be particularly aware of changes in behavioral and emotional symptoms such as increased depression in your adult child. Keeping track of this can all be very stressful, but you may find that organizing your life will help. You may feel that keeping your loved one organized is challenging enough, but taking time to organize your own health can have physical health benefits. The first, most important step to getting organized is using a calendar. Utilizing the calendar app on your smartphone can be great too. You can share appointment reminders and events with other family members. Getting into a routine also helps keep you organized. Write notes to yourself about things that need to be done, schedules, purchases, and so on. What are things that need to be done each day around your house? Each week? Each month? Having a list of these tasks posted can let people in your household know what needs to be done. You can utilize the note-taking app on your phone as well to keep lists with you wherever you go. Doing one thing at a time may seem like an odd organizational goal, but if you try to multitask too much, things are not done well and in some cases not completed. When you delegate, you share responsibilities. Depending on the injury, it is important that your loved one share in household upkeep. Assign or ask family members to volunteer for tasks on your list. Do not try to do it all by yourself. It's not fair and it's not good for your health. When making your to-do list or filling in your calendar, block out time each day, at least 15 to 20 minutes, to do something relaxing for you. Take a walk, watch a favorite TV show, sit in the yard and watch the birds. It doesn't matter. You need to rest for your body and for your mind. Schedule the time the same way you schedule a doctor's appointment. You're just making an appointment with yourself. Another cause of stress can be keeping track of medical bills and medical records for yourself and your loved one. If you have a filing or organizing system for your important documents already, that's great. However, if you don't, creating one is a stress reducer. Using file folders and a small filing cabinet, create files for your bank statements, any investment information such as stocks, bonds, retirement or pension funding you may have. Include any car or homeowners or renters insurance documents. Keep wills in a safe place. If you have a safe deposit box, keep information about where it is and where the key is. Keeping tax records for 5 years is a good idea as well, as the deeds or mortgage information about any properties you own or make payments on. Have a file for your Social Security information as well as any Medicare or Medicaid benefits you or any family member receive. Advance directives are important for every adult in your home. If you are injured or sick and become unable to make your own medical decisions, who in your family would you like to make those decisions for you? If something were to occur which caused you to be put on life support, how long would you want to be left on life support and under what circumstances? These are issues you can discuss with a doctor. The VA hospitals will set up free advance directives for veterans. Lastly, and very importantly, keep track of your health insurance policies, bills, correspondence, and benefit information. Know what you and your loved ones are entitled to and who to call in the event you have problems or questions. Many people scan their important documents onto their computer and then store them in a secure, encrypted cyber storage box, such as iCloud. Another way to stay organized is to keep your important things in one place in your home and let other family members know where to find them. Keep all your loved ones' medications in one place. Have a list of all medications and supplies your loved one needs and how often. Include the phone numbers of doctors. Make sure family members know where insurance documents are as well as any important legal documents. Keep your current or pending bills in one place. Keeping your living space uncluttered also decreases stress and makes it easier to find things when you need them. Keep what you need, throw or give away what you don't. Don't overschedule yourself or your loved one. It's difficult to be a caregiver and keep up with activities you may have been committed to before your loved one's injury. Simplify your life. It's difficult to tell people no at times, but your loved one's recovery is as important as your own health. Say no to extra unnecessary activities without feeling guilty about it. Say yes to the ones that help you out and make your life easier. Set limits for yourself and be comfortable with that. Remember, technology is here to help you as well. Sign up for My Healthy Vet at www.myhealthe.va.gov. It has online screening tools, appointment reminder options, prescription refill ordering, viewing test results, and in some cases, secure messaging with healthcare providers. If you have a specific caregiving issue or problem, visit www.caregiver.va.gov for more help and direction. Staying organized is much easier when you have family members to help out. Make sure and communicate with others what needs to be done and when. While your loved one is recovering, there may need to be changes in how things get done around the house. Make sure and show appreciation for each other and the teamwork necessary. If you have younger children, assign them age-appropriate chores or tasks that contribute to the family operations. Allowing people to choose what they will do helps ensure more accountability, but you may need to offer choices. Do you want to be responsible for the yard work or keeping the bathrooms clean? As a family and with your loved one, talk about goals. Are changes needed? What are you as a family working toward? What is your loved one working toward? What is best for the family as a unit? Knowing where you are going makes doing the work to get there easier. Change in a household is stressful, and in some cases, you may need to let some things go for now. What are the priorities that absolutely need to happen around the house? What are some things that can be left alone for a while? Make sure everyone knows what to expect from one another and that taking advantage of anyone or allowing someone to do more than his or her share of the work is counterproductive. Set boundaries. Everyone in the house should take care of themselves to the best of their ability and not depend on each other to do what can be done on their own. When a patient is recovering from an illness or injury, the goal is to restore as much independence as possible. As a caregiver, there are probably things you stepped in to do that your loved one did before, and this is fine for a time. The goal of your household should be interdependent relationships. A dependent relationship is what the word suggests. One person depends on the other for financial, emotional, or practical support. This is normal in a caregiving, care receiving relationship, but the dependency should decrease over time as your loved one becomes capable of doing more and more. We become emotionally dependent on someone when our emotions and self-esteem are tied to the other person's actions or reactions, and this is unhealthy. Codependence exists when there is an imbalance of responsibility in a relationship. One person feels overly responsible for the other person and does things that the person should be doing on their own. Some people are compelled to do this because they want to control or direct the situation. Some people do this because they feel they cannot function without the other person in their life, and this is also unhealthy. An independent person is not dependent on anyone else for money, self-esteem, or self-care. They take responsibility for their actions, emotions, and thoughts. Interdependence, however, is a goal. An interdependent relationship exists when two independent people share responsibilities and rely on one another without taking advantage and make one another's lives easier. They treat each other with mutual respect and care. Neither person feels threatened by the other's independence. Instead, they are proud of it and happy about it. Caregiving can take a toll on your sleep, your energy, your time, and your relationships. If you are married or have a significant person in your life, take time to talk about how your adult child's injury has impacted your relationship. You may have less time together, You may have become less physically intimate. Show appreciation to each other for what each one of you does to help and what each one of you does to nurture your relationship. Try and be positive. Recovery for your adult child takes time, but come up with ways to share some private time together. Do something you enjoy together. The expectations you had for each other before your adult child returned home were probably different than they are now. Address the new reality and what each of you can still expect from the other and what you may need to let go of just for now. Let your spouse or significant other know you are committed to the partnership. Remember to say I love you, say thank you, and just as you make time for yourself to relax, set aside some time for the two of you to relax together. Taking care of your physical health is important, but taking care of your emotional health is important too. If you can get out of the house with or without your loved one, do it. A change of scenery can be mood lifting and take your mind off the worries at home. Make sure and stay social. Maintain your friendships. Try to go out with friends or invite one or two over. If your loved one is unable to be left alone, this can be difficult. A family member or friend might be willing to give you some time off or contact the caregiver support coordinator at the medical center to find out about respite care. Go ahead and treat yourself once in a while. Go get a manicure, go out to dinner, or just go see a movie. Another way to take care of you is to set goals for yourself and work toward them. Do you want to save money for a weekend getaway? Do you want to get in better shape? Redecorate the living room? Plant a garden? Take a class at the community college? Break your goal down into the steps needed to achieve it. What are some obstacles to your goal, if any, and how can you manage them? Create a timeline. By when do you want to achieve your goal? What can you do each day or each week to get there? You may need to adjust what happens and when, but persist. Progress toward a goal elevates your mood and decreases stress, not just achieving the goal. Just stick with it. Caregiving is a tough and important job. Another important job is taking care of you. Your physical health is just as important as anyone else's. If you do not take care of yourself, illness or injury could prevent you from taking care of your loved one. Take steps to control what you can in your life. Eat well, exercise, get plenty of sleep, avoid misusing alcohol or other substances to cope with stress. Keep track of financial and legal issues and get your life as organized as possible. Know what benefits are available for you and your loved one and reach out to resources that can help or provide information. Strive to build interdependent relationships in your household and understand that having an injured family member does change things. It changes the roles you once had. Try not to neglect your relationship with your spouse or significant other and stay social with your friends. All these strategies work to benefit you and help you be your healthiest. This concludes our module. The next module in our webinar series presents ways to help you, the caregiver, manage the emotions that caregiving often brings.